Hello, my name is Wood Pope. I'm a general orthopedic surgeon here at OrthoGeorgia, specializing in shoulder, hip, knee, and foot and ankle conditions. Today I wanted to talk to you about a very painful shoulder condition known as adhesive capsulitis. This is also known as frozen shoulder, and you may have had a friend or family member that has been told that they had a frozen shoulder. This is a condition that we see that typically affects women more than men, and it typically affects diabetics about 5 times as frequently as non-diabetics. Our shoulder joint is by far our most mobile joint in our body, and if you could envision a shoulder, it's much like a golf ball sitting on a golf tee. So if this is your golf tee, known as your glenoid or your socket, and the humeral head is the golf ball, it's a really large head sitting on a small socket. So this is a model of a shoulder demonstrating that. The benefit of having geometry shaped like that is that it provides enormous range of motion. The capsule that surrounds the ball and socket provide for that motion. If you develop this adhesive capsulitis condition, the capsule becomes very constricted, preventing you from being able to abduct your arm, externally rotate, or internally rotate your shoulder. Oftentimes, this is not preceded by any type of injury. Most patients will say that they just woke up with shoulder pain and stiffness, and it is most comfortable to hold their shoulder at their side. Well, unbeknownst to the patient, that is probably the worst thing you can do, as the capsule will simply get tighter and more constricted. By the time we see patients, their motion is typically very limited and quite painful at the extremes of motion. We typically will x-ray the shoulder joint to confirm that there are no underlying bony conditions. The x-ray is typically normal. We will then examine the patient. Rotator cuff strength is typically normal, although motion is significantly limited in both an active and passive manner. Typically, the way we treat this is with a steroid injection into the ball and socket joint, followed by physical therapy. This therapy is the key to getting over this condition, and typically you will begin to see resolution of pain and stiffness over the course of 6 to 8 weeks. If you feel like you potentially could have a frozen shoulder, please do not hesitate to come see us at OrthoGeorgia for an evaluation.